Welcome to the Area Development Partnerships Rise Up Professional Development Series. I'm Valencia Williamson, Executive Vice President of the Chamber of Commerce Division at Area Development Partnership, and today's program is Effectively Navigating Human Resources During COVID-19. So we've received a number of questions from employers regarding paid sick leave and the Family and Medical Leave Act, and our team felt that this program and the information that will be shared today is not only timely, but incredibly relevant as we're navigating through such an uncertain time. I'd be remiss if I didn't thank our partners, the University of Southern Mississippi, the Petal Area Chamber of Commerce, and Hattiesburg Downtown Association. Through this time, we need our partners more than ever. So thank you very much for participating with us. Before I introduce Jennifer Scott, I'm going to give you just a few housekeeping tips to get you through today's program. So the program is scheduled for about 1 hour. We'll have a Q&A session towards the end of Jennifer's presentation. And at the bottom of your screen, you should see a Q&A function. You'll be able to enter your questions throughout the session here. At the end of her presentation, we'll come back and ask all of these questions, or as many that we can get to during the time allotted, and kind of go from there. The chat function is also enabled to where you can speak with the presenters. So you'll be able to talk to me and other presenters throughout the session, but unfortunately not each other. We want you focused in on Jennifer. Also, lastly, I know a lot of you were wondering, but we will be recording today's session, after which it will be made available on our social media and on the ADP website. So visit us at www.theadp.com to get this information. Also, I'll take a moment to put in a shameless plug for our social media. Please follow us on Twitter, LinkedIn, Facebook, and Instagram so you can stay up to date on all the latest information as it relates to COVID-19, but also the business community at large. So at this time, I'm going to introduce Jennifer Scott. I'm going to read just a little bit of her bio so you can get a little background on her, and then we'll turn it over to Jennifer. Jennifer Scott is a shareholder and attorney and has been a member of Wise Carter Childs and Caraway since August 2004. Jennifer helps employers develop and implement forward-thinking, customized HR policies so that they can grow their businesses and attract and retain top-notch talent. An advocate on behalf of employers facing litigation and administrative actions from current and former employees, Jennifer provides these employers with experience, expert guidance, so that she can end disputes and focus her energies on their business operations. Jennifer also defends workers' compensation claims and helps employers and carriers manage workers' compensation programs so that they can reduce the cost of workplace injuries and ensure compliance with Mississippi law. So without further ado, we welcome Jennifer Scott.
Hi, good morning. I'm so glad to be here with you all and to get to talk to you a little bit about effectively navigating HR issues during this COVID-19 pandemic that we're facing. And this is really a time for, I think, us to shine in the realm of human resources because businesses are really focused on keeping their most valuable resource intact, safe, and helping to keep their businesses going through focusing on the human resource that they have to do that. So let's talk a little bit about some tips for navigating through that. There's a lot to discuss in this area, and we're going to focus on 2 issues today. So just so you have a kind of overview of what our discussion will be, we're going to talk about leave issues and then also some telework and work from home issues. And so as we go through questions about leave, I want to look at some sources of leave entitlement, federal laws, and then also an employer's own leave policies. I want to give you a framework that you can use in evaluating leave requests, and then go through some just frequently asked questions, some common scenarios that I see in leave area. And then we're going to talk a little bit about telework and work from home issues. And I want to start there by giving you some ideas on how to evaluate feasibility and then setting expectations for your employees with teleworking, and then how you can ensure compliance with those expectations. We'll also have a few frequently asked questions for some situations that come up repeatedly in the telework work from home arena. And then we'll have some time at the end for questions about other issues that you may have. All right, so the first thing that we've got, and the thing that you probably have heard a lot about recently, is the Families First Coronavirus Response Act and the FFCRA. We're adding to the vegetable soup of HR law, definitely, with this regulation. But this law became effective on April 1st, 2020. It has a sunset provision that will terminate the law on December 31, 2020. And there are two components of the FFCRA that entitle employees to paid leave for certain COVID-19 qualifying reasons. And the first is the Emergency Family and Medical Leave Expansion Act. And the second is the Emergency Paid Sick Leave Act. And so I want to talk a little bit about both of those, because these are the primary federal laws that entitle employees to paid leave for COVID-19 reasons. So in talking about both the expanded Emergency FMLA expansion and the Emergency Paid Sick Leave Act, covered employers, the coverage is the same in both components of the Act. So private employers with fewer than 500 employees are covered by the Act. And this is a little bit different than what we normally have in employment law. Most of the time, coverage is dependent on meeting a certain minimum employee threshold. And in this one, it's dependent on not exceeding a maximum. So if you are a private employer and you have more than 500 employees, you are not covered by these provisions of the FFCRA. If you have fewer than 500 employees, you are. The law also defines it defines covered employers to include public employers. So that would include a political subdivision of the state. And coverage for public employers is without regard to the number of employees. So as long as you have one employee, if you're a public employer, you are covered by the provisions of the expanded FMLA and the emergency paid sick leave. Now, there is an exemption for private employers with fewer than 50 employees, where there is a demonstration that compliance would jeopardize the viability of the business as a going concern. And the implementing regulations identify three very specific certifications that have to be made in order for a small business to meet this exemption. I've listed those out on this slide. The certification has to be made by a certain officer or director of the business. So in talking about who is an eligible employee, there is a little bit of a difference between the emergency FMLA expansion and then also the emergency paid sick leave. So let's talk about those separately. And the first is the expanded FMLA. And an eligible employee for purposes of expanded FMLA is anyone who's worked for an employer at least 30 days prior to the date the leave is to begin. So if the employee has been on your payroll for 30 days prior to the date that the leave would begin, they're eligible for leave under this act. There is a special rule that allows an employer of an employee who is a healthcare provider or emergency responder to elect to exclude the employee. Now, the regulations contain very specific definitions for the purposes of this exclusion of both a healthcare provider and an emergency responder. All right, the qualifying reason for leave, there's only one under expanded FMLA leave, and that is the employee is unable to work or telework due to a need for leave to care for a child under 18 years old if the child's school or place of care or child care provider is closed or unavailable due to a COVID-19 emergency. There is no other qualifying reason for leave under the expanded FMLA component of the FFCRA. All right, so the leave benefit that's available under this expanded FMLA leave It's up to 12 weeks of job protected leave via accommodation of unpaid and paid leave. And it does not expand the total FMLA leave time available. And that's really important if you're an employer who is already covered by traditional FMLA leave. That means that the total allotment, that total 12-week allotment, stays the same. It's just adding a reason for which an employee can use that paid FMLA leave. So you want to make sure that's why it's always important to really document carefully and track FMLA use among your employees, because that will make a difference on whether they are eligible for leave and how much leave they're eligible for under the expanded benefit. All right, so the combination of paid and unpaid leave works with the first 10 days of the leave. 2 weeks may be unpaid leave. And that means that the employer may not require the employee to substitute paid leave. However, the statute specifically says that the employee may elect to substitute any paid leave available. So that includes any employer provided paid leave or leave under that Emergency Paid Sick Leave Act. And we'll talk about the interplay between these two components in just a minute. But the remainder of the leave after the first 10 days is paid by the employer at 2/3 of the employee's regular rate of pay for the number of hours that the employee would otherwise normally be scheduled to work. Now, if you've got an employee who's full-time or a part-time employee that works a really regular schedule, then it's a fairly simple calculation to make for the amount of time that the paid leave would be available. It gets a little more complicated if you've got irregular schedule employees like a PRN employee or part-time employees that work variable schedules. And the implementing regulations do contain some very specific examples and guidelines for how to make those calculations if you have employees who would fall into that category. There is a cap on the benefit that's available, though. The maximum benefit per employee is $200 a day and $10,000 in the aggregate. All right, since this is FMLA leave, remember that it's job protected leave. That means that employees have a right to reinstatement at the end of the leave period under the same, to the same extent that they would under traditional FMLA leave. For the expanded FMLA leave, there is a special provision relating to job restoration for private employers with fewer than 25 employees. And it does not exempt those employers from all obligations to restore the employee from to work at the end of the leave period. It just contains some a little more fluidity in doing that in cases where there may be a downturn in business, or it really is just not practical economically for the employer to restore the employee to work. So let's now turn our attention to the Emergency Paid Sick Leave Act and talk about eligible employees under that, that component. So an employee for this component is defined by reference to the FLSA. And there is no minimum length of employment here. So the employee is eligible for this paid leave benefit from day one. Now, an employer of an employee who is a healthcare provider or emergency responder may elect to exclude the employee from coverage. That's the same as the exclusion that's available under expanded FMLA leave. And the definition of those terms is the same for that purpose. So the qualifying reasons for leave, there are 6 qualifying reasons for leave under emergency paid sick leave, and I've listed those out for you here. So the first one would be that the employee is subject to a federal, state, or local quarantine or isolation order, or the employee has been advised by a healthcare provider to self-quarantine. The third reason, the employee is experiencing COVID-19 symptoms and seeking medical diagnosis. The fourth is that the employee is caring for an individual who's subject to a state, federal, or local quarantine or isolation order, or who has been advised by a healthcare provider to self-quarantine. Reason number 5, caring for the employee's child if the child's school or place of care or child care is closed or unavailable due to a public health emergency. And then the 6th one is really a kind of catch-all provision if you're experiencing some substantially similar condition as defined by HHS, Treasury, and Labor. So let's look at these a little bit before we move on to the next slide. And I want to point out a couple of things to help group them together as we move on in the discussion. But the first 3 reasons all relate to healthcare issues that are unique to the employee. So the employee herself needs to isolate or has been advised to isolate or is experiencing symptoms and is seeking a medical diagnosis. Reasons 4 and 5, and arguably 6, don't involve the health care condition of the employee themselves, but it's a need, the employee needs to care for someone else. So those are needs outside of the employee. And you'll notice that reason 5 is the same reason that we had for expanded FMLA leave. So there's a overlap between the expanded emergency FMLA and this emergency paid sick leave. One other thing I pointed out that I think is really important, reason number 4, to care for an individual. The statute doesn't limit this to family members. And those of you who are familiar with how traditional FMLA leave works, leave to care for an immediate family member who has a serious health condition under the FMLA, traditional FMLA, it's a relatively narrow number of family members. There are only certain relationships that will qualify under that. This is much more expansive. And the implementing regulations do have some discussion of that, but it's not limited to family members. So the benefits, the leave benefits available under this emergency paid sick leave, it's up to 80 hours of paid leave or 2 weeks for full-time employees. And for part-time employees, it involves a number of hours worked on average over a 2-week period. And again, just like we talked about with expanded FMLA leave, in situations where you've got an employee who works pretty regular part-time hours, it's an easy enough calculation. It gets more complicated with irregular schedule or variable schedule part-time employees. And there is specific guideline in the regulations on how to do that. So the pay for leave, if it's for the employee's own health condition or quarantine, so that's reasons 1, 2, and 3 that we talked about, then the leave is paid at the employee's regular rate. It's the full rate of pay for the 2 weeks. But there is a cap on the benefit. So it's limited to $511 a day or $5,110 in the aggregate per employee. Now, if the leave is to care for others, so reasons 4, 5, or 6 on our list, then the leave is paid at 2/3 of the employee's regular rate, and the benefit is limited to $200 a day or $2,000 in the aggregate per employee. So let's talk just a minute about how this intersects with the expanded FMLA leave that we talked about. You remember that expanded FMLA leave, the first 2 weeks of leave is unpaid. The employee may substitute paid leave if the employee elects to do so. And the implementing rules and regulations for the FFCRA make clear that the intent is the employee would be able to substitute emergency paid sick leave this 2 weeks for that first 10 days of FMLA leave. Those would run concurrently. So the employee doesn't get 14 weeks total for leave to care for a child whose school is closed, but the maximum under the FMLA would be 12 weeks with the first 2 weeks substituted as paid leave for this. Now, keep in mind the employee does not have to substitute the paid leave and the emergency paid sick leave, and an employee is able under the rules to substitute any available paid leave. So you could have a situation where an employee whose child is out for school does not elect to substitute this EPSLA leave for that first 10 days, but either takes that 10 days unpaid or substitutes other paid leave that's available to the employee, uses the 10 weeks and sort of saves this EPSLA leave for another COVID-19 qualifying reason. This leave, though, this 2-week emergency paid sick leave, it is a one-time 2-week maximum benefit. So you cannot have 2 weeks for each of the 6 reasons. You get 2 weeks, and it can be, if you have more than one reason that would need more time, then it would not qualify for this emergency paid sick leave. All right, a few other sources of leave entitlement that I want to talk to you about real quick that could be a factor in looking at COVID-19 leave requests. And the first is traditional FMLA leave. Now, remember, you would have to be a covered employer under FMLA leave. So that's certain public employers, private employers with more than 50 employees. And then your employee would have to meet eligibility requirements, and those are much different for traditional FMLA than they are for the expanded FMLA. The employee would have to have been employed for 12 months, not necessarily consecutive, would have 1,250 service hours in the 12 months immediately preceding the date the leave was to start. And then there are also certain worksite location requirements in order to be an eligible employee. I think that there is a possibility that an illness caused by COVID-19 could qualify as a serious health condition under traditional FMLA leave. There is a component for continuing treatment. And again, those of you who are familiar with how FMLA leave works, a serious health condition, even something like the flu could qualify under FMLA leave if it took an employee out of work for a sufficient amount of time, and there was a prescription for medication, there was follow-up treatment, that sort of thing. So I think you need to be on the lookout for that. And also remember that it could qualify under a serious health condition of an immediate family member under traditional FMLA leave. You also should be mindful of the ADA as a potential source of leave for COVID-19 related reasons. And again, COVID-19 illness is unlikely to, in and of itself, be an ADA qualifying disability. However, an employee could have other ADA disabilities that might create a need for leave related to COVID-19. So think about an employee who has a pulmonary condition, someone who has asthma, someone who has some other health condition that would be an ADA qualifying disability that puts that employee at risk for infection, a higher risk of contracting COVID-19 or higher risk of complications if they do contract it. And so they therefore are under a doctor's order to isolate or to work from home, something like that. You would be, at that point, you would be in your reasonable accommodation analysis. And I think it's just important to remember that leave can be a reasonable accommodation under the ADA. So that's why I added this one in here. Also remember that your own leave policies can provide a source of leave entitlement for your employees. That seems like an obvious statement, but think about your PTO, vacation, personal, sick leave. You may even have policies that make employees eligible for unpaid leaves of absence. And I think it's important in all of those to review your policies and make sure that you follow them, because some employers have sick leave policies that will only allow sick leave to be used for sickness and not for, for the employee's own sickness, that you can't use extra sick leave for personal reasons. And some things may not qualify if you're caring for a family member who's got COVID-19 and there's no FMLA leave available, or they want to substitute paid sick leave. That may not be allowable under your policy. And so certainly you can follow the guidelines in your policies. You just need to administer those uniformly. So let's talk a little bit about how to respond to leave requests. And I think that this sort of pattern for responding to leave requests really will go for anything, not just COVID-19. But the first thing that you need to figure out is, why does the employee need leave? I think that articulating that is really important because that's going to make a difference whether there's leave available under expanded FMLA, traditional FMLA, whether you maybe need to think about, is this an ADA accommodation issue? Is there something in our paid leave policies that would allow you to use paid leave? Is this qualify for emergency paid sick leave under the FFCRA? All of those things. I think in a time when we're dealing with COVID-19 related leave questions, another important question to ask is telework or work from home possible? Because remember that under the FFCRA, for both expanded FMLA leave and emergency paid sick leave, there has to be a need for leave because the employee is unable to work or telework. So it's important to kind of think through that issue. Does this employee really need leave? Can we allow them? Are they capable of working? And if it's just a quarantine or an isolation order, that's probably true. If the employee is actually sick, it may not be possible. It may be inconsistent with them working. But if telework or work from home is possible, certainly you want to think about whether that is an adequate solution to the problem so that leave is not actually needed. All right, and then you need to think about, is the reason for leave, is the reason one that would entitle the employee to leave under federal law? And I think you should also consider state law. I didn't add that into this slide because in Mississippi, there really are no state laws that entitle employees to paid leave. But if you were in other states where there are a lot more state law regulations on paid leave, like California, you would certainly want to consider whether there is an entitlement to leave under any federal or state law. So if there's no federal or state law right to leave, then you need to think about, is leave available under your employment policies? You also need to be thinking about what documentation is needed to establish the need for leave. This is particularly important under the FFCRA for expanded FMLA and emergency paid sick leave because private employers are eligible to take payroll tax credits for leave benefits paid under those laws. The implementing regulations from the Department of Labor and also the IRS do set forth documentation that the employer should keep in order to establish that the leave was qualifying and that the employer was indeed entitled to take the tax credit on the payroll taxes. So you need to make sure you understand what documentation you need and you get all of that together. And then I think it's really important to, at the outset of the leave, to make sure that you have a good understanding from both the employer and the employee of what are the leave parameters. And that includes things like understanding the duration of the leave. When is it going to begin? When is it expected to end? Is this leave going to be paid or unpaid? What sort of leave entitled allotments will the employee be using in taking this leave? You need to think about issues like continuation of benefits, health care, other benefits. Is the employee going to accrue paid leave while they're out on this leave? You also need to discuss job restoration issues. And remember, under FMLA leave, traditional FMLA and expanded FMLA, job restoration attaches if the employee can return to his or her job at the end of the designated leave period. If they are not able to do that, then the obligation to restore them, extinguishes under that law. So, make sure that the employee understands that. I really think it's important for employers in any leave situation to have some form or written process that they go through. If you're a really, really small employer, like maybe 2 or 3 employees, maybe you could do all of this just through oral request. But I think documentation is important, and it's really important now for COVID-19 related reasons because the employer could potentially be getting tax credits, and you want to make sure that you have the documentation that you took those appropriately. You need to track the amount of leave that the employee has, what they've used, when they've used it, and also understanding the reason for leave, because some reasons are not eligible, and having the employee really articulate that at the outset can help you answer a lot of questions and understand what your obligations are. So I think forms are a good thing to do. Have a checklist that you use when you go through and analyze these. It also helps make sure that you evaluate all of the request in a uniform manner, and that helps minimize, your risk of claims that you handle the request in a discriminatory manner. All right, so I want to talk about a few frequently asked questions that I get. And the first one that I see come up a lot is an employee entitled to leave because of fear of infection or exposure? And the answer to this one is generally no. The provisions of an employer's leave policies might govern request for leave in this case, but fear of infection or exposure is not going to qualify for leave under expanded FMLA, emergency paid sick leave, traditional FMLA, or the ADA, absent some really, really unusual circumstances. If I thought about it, I could probably create some situation where it might qualify, but I think you would have to have an employee who had some sort of, legitimate mental or emotional disability or condition that made this fear a component or outgrowth of that. But just normally, some unfounded fear is not going to be sufficient to qualify for paid leave under these federal statutes. I think the way to handle this kind of request for leave is to really focus on informing and educating your employees to help alleviate the fear. And, one of the things that you want to communicate to your employees is what the employer is doing to keep the employees safe. And so to have the employees understand that as an employer, you are keeping up with the latest guidance on the CDC's website, that you're keeping up with the latest information from the Mississippi Department of Health, that you are mindful of OSHA standards to the extent those apply to you, and that you are taking efforts to ensure employee safety and to prevent the spread in your workplace. I think you can refer the employees to the CDC website. It's got some great information on sort of distinguishing fact from fiction, and make sure that the employees are getting their information and their news from reliable public health sources like the CDC, and not just from what somebody's saying on Facebook, which may or may not be true. I think you should also really consider carefully whether the employer is setting an undesirable precedent if leave is granted to employees based on unfounded fears. And one of the things in this situation is that, a lot of people are scared right now. A lot of employees are fearful. And to give that traction in the workplace can be a problem, because the employees, at what point do you draw a line and say everybody can't go home and not work because they're afraid? If my business is one that can continue going, and if I am complying with CDC guidelines, and if I'm doing everything I can to keep the employees safe, then to keep business going, to keep operations up and running, we need people here working. And so it's just, I think it's something that an employer should take a firm stance on, and really work on developing a collaborative, understanding with the employee about why it's important for the employee to be there, and that the fears are unfounded. All right, another question that I get often is about requests for leave or telework as an ADA accommodation, and do employers have to grant those kind of requests? And really, this is one that the answer is it depends. So remember that both leave and telework can be reasonable accommodations under the ADA. And under the ADA, an employer must provide a reasonable accommodation unless doing so would cause an undue hardship. And undue hardship is a very fact-intensive analysis. It involves things like considering cost, the effect on business operations, There are some other factors that play in there also. So I think one of the most important things here is to make sure that when you get this kind of request, you engage in that interactive process with the employee, because there is an independent obligation under the ADA for employers to do that. And that really means having a conversation with the employee, making sure that you understand what the employee needs, that you've gotten any medical certification that you might need and be entitled to under the Act, and you have a good understanding what's being asked for. And then I think you should also consider your own precedent as an employer. In other words, you should look to how you've handled similar situations in the past. And I also think it's important to think creatively in these kinds of situations. You know, generally, if you've got a situation where you have an employee who really wants to work and the employer needs that employee to work, the best solution is to figure out a way to remove any barriers to allow that employee to continue to work. And that's what the ADA is about. That's what the whole idea of a reasonable accommodation is based upon, the idea that an employer and the employee come together to remove any barriers that prevent the disabled employee from working, so that the employee can work on the same terms and conditions as an employee who's not disabled. All right, so let's talk a little bit about telework now. I'm going to move on to the next subject. And the first thing that I've got is just really kind of evaluating some ideas for evaluating whether telework or work from home is even possible. And so the first, most obvious question is, does the employee have to be in a specific physical location to perform his job duties? And that's really the litmus test for whether work from home is possible. There are some jobs that have to be in a specific place in order to do the work. The work site can't be moved. Those employees, telework is not going to be an option for them. But I think in this case, in this pandemic crisis that we're facing, that the second question is an important one to ask. If you have an employee that you say, yeah, this employee's got to be in the physical work site to do his job duties, I think it's important to then ask, well, is there anything else that the employee is qualified to perform? Are there different job tasks that this employee is qualified to perform that could be done remotely? And so think about special projects or temporary assignments, things that you may have that need to be done that you never have time to get done during normal operations, are those tasks that can be done remotely. And you might think about, if you're trying to scan files or documents, things that you might normally outsource, could you bring those in-house and have someone do them so that you could continue to, pay them to work and they could work remotely? You need to think about the resources that you're going to need, of course, to allow work from a remote location. So your IT equipment, access to files, interacting with coworkers, all of the things that you would normally do in a shared workspace. How are you going to do those things when people are not in a shared workspace? And then I think you have to think really carefully about security and confidentiality concerns from a work site. How are you going to ensure that your customer and client's information is kept confidential and secure? And this can particularly be an issue if you've got a situation where teleworking employees are going to be using their own devices. So if your employee is going to be using her personal desktop computer at home, how are you going to ensure that information stays on your server, doesn't get on that hard drive? If an employee is going to be answering phone calls on the cell phone, or receiving, transferring documents through text messages. You may have those issues already because a lot of people do work from home now, even when they are normally at a work site, but certainly think through those issues. And then another really important issue to think about is, how are your managers going to adapt to supervising and leading teleworking employees? Because this is going to be really different. Everybody's not going to be in one shared workspace. And so the way to sort of get that supervision and that productivity going may be different. One of the really key things in managing work from home and telework is setting expectations for telework. And the first expectation that you have to communicate clearly to everyone is that telework is not leave. We are all still working. The employer is changing the employee's physical work site, but not the expectations for employee performance and work. It's important to communicate that established policies will continue to be in effect, and think about what policies those are: work hours, production standards, reporting deadlines, professionalism, leave requests or vacations, confidentiality. The important thing is to communicate to teleworking employees, we are not suspending all of the policies that we include in our personnel handbook. Now, some of those may have to be adapted somewhat, but certainly the basic ones are going to remain in place. You also want to communicate to the employees at the outset of the arrangement that an employer may request the employees to come to the work site periodically, and that it can end the telework arrangement at its election. Now, of course, your backstop on this is to make sure that you're complying with any state or local shelter-in-place orders, or orders that require you to not have your business operations open. So assuming you're essential and can have an office space open and you're following the CDC guidelines for safe office spaces, then certainly you can have your employees come in periodically if there's some job task that they need to be on site to perform. And if telework doesn't work out, then you can, have everybody come back to the work site. You want to support your employees in developing new ways to communicate with coworkers, managers, clients, and customers. And this can be things like, making sure that they have in place programs like Microsoft Teams, or they have some secure GoToMeeting or Zoom or other platforms that allow them to communicate. You want to support your managers and supervisors in effectively leading their teleworking team members. And that may require some separate discussions and trainings with them to make sure that they are able to transition to being a supervisor or leader with a remote workforce that's dispersed, in various locations. And of course, I think it's really, really important that you develop a telework policy to clearly communicate all these expectations. And I think a policy in this regard needs to address a lot of things. I mean, you even need to address things like if your employee is going to take your equipment into their home. So an employee who maybe doesn't have a computer or doesn't have a computer with a processor at the speed that you want, if you're going to allow them to take their computer from their office home, they need to understand, that they're responsible for that while it's in their home. You need to address the time frame for telework, what expectations are still going to be in place, what time frames the employee is expected to be available to discuss or to respond to a manager or to coworkers or to clients. All of those things, it just needs to be set out. It's important anytime as an employer that you expect an employee to meet certain marks. It's important that those marks are clearly communicated to them. So it's unreasonable to want an employee to meet expectations unless you've clearly defined what those expectations are. So some compliance issues with work from home, and these are just 3 areas that I think tend to come up in this. And the first big compliance issue is FLSA, timekeeping and compliance. So for non-exempt employees, remember that they must be paid for all hours worked. So you have to be able to track their time accurately in order to know how to pay them. And there can be challenges where non-exempt employees have access to work email or phone calls on their personal devices as a result of teleworking, especially if they have not had that before, because you want to make sure that they understand that they're only to check their work email during regular office hours, and if they get an email after that, then they should just let it go until the next day, because otherwise that's going to be time worked for them. You also want to make sure that whatever your timekeeping system is can move to the telework arena. I think most employers probably use some computer program where non-exempt employees log their time, and that would transfer to a remote work site. But if you happen to have an actual time clock at your work site, that employees are expected to, mark the time that they arrive and when they leave, you will have to find some way to move that system, not the time clock, but you just got to move the timekeeping system to the virtual workspace. And then, I think it's really important in this that you understand and that your employees understand, regardless of telework or work at a specific work site, that falsifying time records is treated as a serious violation. And one question that I get from employers a lot on issues relating to work from home or telework is, how do I know the employee's actually working and not watching Oprah? And what I say to employers in that is that if you have an employee that you have legitimate or genuine concerns that they're not working when they're saying that they're working, then I think you should really consider whether there is a bigger problem than telework. I mean, there's a different problem with that employee, and you should perhaps think about whether that's an employee you really want to have with you. So productivity standards can be a problem, and then workplace safety. You just want to make sure that your employees understand that they should report any work-related injuries, even if they occur at home. So that doesn't mean if they're injured in their home, it's automatically work-related because they're working from home. But if they're in their designated workspace and they drop their work laptop on their foot and break a toe, they need to report that. Okay, so a couple of questions. I'm going to go through these really quick because I know we're getting short on time. But can we allow some but not all employees to telework? Generally, yes, provided there's no discriminatory basis for that. The focus on telework should be, job tasks when you're making decisions, and just some tasks can't be performed away from the physical work site. How do we make sure teleworking employees are actually working? And this one, I think the best way to answer it is with another question, and that is, how do you make sure employees are actually working when they're at their normal physical work sites? It's the same principle. That's what you do on teleworking. You want to schedule regular meetings, set deadlines for completing tasks, evaluate performance regularly. You want to address and correct problems as they arise and really document that and enforce your established policies on all of those things. I think it's really, really important to remember that no matter where the employees work, they are always responsible for their own performance, and they should be held accountable for their work. And that is the dynamic that should be in place even for teleworking. So we really already addressed this. Can you require a teleworking employee to return periodically to their work site? And generally the answer is yes. Employees don't have a right to telework. There could be some ADA overlay that would change that answer, but you want to focus on the business needs. I would caution you to think really carefully before returning an employee to the work site as a correction for an employee that's failing to meet productivity expectations while working from home, because you don't want to have a situation where the employee requires constant supervision at the work site to ensure he focuses on the task and meets expectation. It's probably not feasible for you to give that kind of constant supervision at the work site. And even if it is, it may not be a good investment of your resources to do that. And it could have a negative effect on employee morale in general. Okay, so that's all I've got for us today.
Thank you so much, Jennifer. What a very informative presentation you just gave us, and all of the details related to leave policies under the Emergency Paid Sick Leave Act. We've got some questions, and I know that our time is very limited at this point, so I'm going to do my very best to get to each one of them. Why don't we hop right in? The first question is, says, can you give examples of the documentation requirements needed in order for an employer to claim tax credits?
Okay, so they are very specifically laid out in the implementing regulations. But for example, if the employee is under a public health order to isolate or self-quarantine, then you would want a copy of that. Or if a healthcare provider has said you need to isolate for 14 days, you would want a copy of the, like a doctor's excuse. For the child care issues, the regulations say, you could have either a letter from the child care provider or daycare, or a copy of something that shows the school is closed. So that would be an option like that. There are some different certifications if it's need to care for an individual, about whether that's going to qualify, whether there's legitimately a need to care for the individual who has to self-isolate. But I think some sort of documentation, certainly if it's a medical reason, that you get a copy of a doctor's excuse saying, this person's required to isolate for however long.
Okay. Our next question is, are there currently any substantially similar conditions specified by HHS in consultation with the Secretary of Treasury and Secretary of Labor? This is a two-part question, so I'll ask part one now. Do you need me to ask that, or are you good?
No, I understand the question. That's reason number 6 under emergency paid sick leave. I am not aware of any. I will say that the regulations were issued April 6th, and there was a correction to them that Department of Labor issued on the 10th. And I don't recall there being anything in either one of those.
Okay, and so the second part was, is this something that for now an employer can be somewhat non-concerned about?
Yeah, I think for right now, that reason 6 is kind of it just gives the Department of Labor some leeway. I think because conditions with COVID-19 are changing so rapidly, and so I think it gives them the option to expand that if needed. But I don't know of anything at the moment that qualifies under that.
Okay, and for our last question, it says here, have the guidelines been issued for number 6 of Emergency Paid Sick Leave Act?
Okay, and I think that's the same question. That's the any substantially similar condition. I think that's the same one. I don't believe that there's anything in the most recent guidelines. Like I said, the final temporary rule was issued and published in the Code of Federal Regulations on April 6th. And then there was a correction or amendment, which the Department of Labor apparently did some erroneous math in one of their examples. They corrected that and a few other things. That was published on April 10th.
Okay, well, this concludes our Q&A session. Jennifer, again, thank you so very much. We appreciate you taking the time today to share this information with our membership and the business community at large.